be a little bit of a semi-phallic position, or they can be supine as well.
Okay.
So yeah, you put your hands down, and you can actually use a cueing technique, right, too. You put your hand down at the base, because she may not have.
Good, she deserves whatever you give her.
So give me a bolster so you can put under her knees. Make sure your head stays that way. Your head turns that way. I'll take it. There you go.
I do all the time, every day.
Oh yeah. Okay, we're here next. So you can put your hand, relax. Done. All right. Pretty long person too.
I guess next time they'll take the
He's
person
telling
hiding
me not
behind
to
their
laugh.
hand.
All right. Lock it up. So I can actually give her a cue, and her diaphragm lies as a dome underneath the base of her ribs and attaches up into the lower part of the rib cage. So if I push up and in, I can give some stimulus to the diaphragm. So when I want her to take a deep breath in, I can kind of quick stretch and say breathe in and blow out. Breathe in, blow out, all the way. Breathe in.
You kind of like double pumping it?
Yeah, quick stretch.
If you have a patient that like their diaphragm can kind of get caught like up by their rib cage, can it?
When you say caught, what do you mean?
Like, I don't really know. But I was reading online at one point, and there was some type of syndrome or something where the person's diaphragm was caught on something. And if they had that, would you teach them diaphragmatic? I guess I'll have to look it up. Never mind. Sorry.
Yeah, I don't know. Yeah, I don't know what
Okay.
you're referring
Never
to.
mind. I'll look it up.
So, I don't know how you can address that. The other thing that you do, if you have someone that has intercostals and you want to work on using the rib cage, because remember they have that areflexive period, so there's muscles that are inhibited, and even if they start to come back, they're still going to be weak from that period of areflexia. Then you can kind of stimulate almost like a bucket handle. Is that the bucket handle? I always get those mixed up. This is the pump handle. No, that's pump handle, isn't it? The side? The side? Or is the front?
This is bucket, the front.
One or the other. So what I'm going to do is now I can quick stretch here. And again, the goal is to get her to expand outward and upward. So, in, so out.
That's for intercostals, right?
Mm-hmm. Just to get
The accessory.
more accessory.
Does it ever become automatic for them?
Not sure what you mean. Because breathing is automatic. It's from your brain.
Like
We're
when
talking
you're,
about weakness here and control issues.
so when you're training somebody to do something, after they do it a certain amount of time, doesn't it start to become automatic?
That's the goal. If you actually strengthen it, if it's weak and that's why it's not working and I'm doing this, hopefully I don't have to walk around with her and, every time she takes a breath. So the goal is once she learns it, then we add resistance to it. So instead of stimulating it, now I resist it.
Okay.
So I can put my hands and just say breathe in, and I'm resisting the upper portion of the chest. Breathe in. And you can do that anywhere, segmentally, because my hands are only so big. And then eventually I can incorporate, once I feel like she's got a decent pattern, then I incorporate exercise on top of it. So what exercise or type of exercise do you think would be good for inhalation? Think about your pattern of breathing. Anything that opens up the chest is good for inspiration, so more extension. And if they can, bring the arms out, and then more flexion and bringing the arms in to blow out. So any activity where you can get that expansion of the chest and then a release from that and have them breathe with it. So inspiration, expiration, inspiration, expiration, so that you're actually getting strengthening of that movement. Because the way to strengthen those muscles is to up the ante with activity. I mean, for like endurance activity and strengthening. And the more you use them, I mean, that's what babies do. We don't wrap a belt around them and say, okay, breathe, or TheraBand around someone's chest and make them breathe against it. It's by moving around and stressing the system that we get improvements in. So once we facilitate it and we're getting a more normal pattern, it will never be normal per se, if the muscles are not intact, but more normal, then we can incorporate physical activity on top of it that supplements it. That makes sense? And then you change the position. So now she's sitting and she's doing it. Now if she's able to, an incomplete injury, sometimes central cord is ambulatory and she does it, et cetera, et cetera. Okay. I want to just talk quickly. I'm going to show you a video on this glossopharyngeal breathing. Glossopharyngeal breathing is a type of breathing that you can teach high cervical lesions, especially if they have some function and they periodically take them off the ventilator. Sometimes patients can come off the ventilator for periods of time, and they can breathe on their own during that time, and then they go back on the ventilator after they fatigue. So this is a way to kind of help them to take a deep breath, or deeper breath, I should say, when they're off the ventilator. Okay. Also, you can use this with neuromuscular diseases, and we're going to see this with muscular dystrophy. The video I have is actually of a young man with muscular dystrophy. And so it's called glossopharyngeal breathing, and basically what you're doing is you're swallowing the air. So you're taking the accessory muscles, take a breath in, and you're kind of shifting it down into your lungs. And that gives you the amount of air you might get with a deep breath, but they're not able to do that. So glossopharyngeal is sort of like gulping, air gulping. Sometimes they call it frog breathing for some reason. Okay. So, and I have a video of that. It's really interesting. I've never seen it used, but it's in your book, so I'm going to tell you that. There's something else in your book called air shifting. And air shifting is where an individual can take a deep breath. And this is really more for more symmetrical aeration in your lungs. You can take a deep breath and they can get the air down into the bottom of the lungs, but it's harder for them to get the air in the top of the lungs. So what they do is they take a breath in and they close their glottis and try and relax the diaphragm. And what that does when it relaxes, it pushes up and it shifts the air to the apical areas in the lungs for aeration. I'm trying to do it in my office and really passed out. That's the problem. You can actually hyperventilate when you do this stuff. So if you ever see me in there and I'm looking and then I'm gone, that's what I was doing. I was practicing something. I was trying it on myself. Okay, so why don't we practice the manual context for diaphragmatic breathing, the cueing, the quick stretch for the diaphragmatic breathing, and then for strengthening intercostals, and then I want you all just to try the glossopharyngeal. Try and swallow the air, not into your stomach, or try and shift it down into your lungs. You'll know if you burp, it's in your stomach. And then we'll talk about the PRAs to strengthen the diaphragm.